Yes, please.
Hello, are you John?
Yes, I am.
Hi, John. Your birthday is February 4th, 1978?
Yes.
Okay, great. My name is Dr. Dennison. I'm a student doctor here at the hospital. I'm going to ask you a few questions today and take some notes. Is that okay?
Yes, no problem.
Great. The first question I have is why you came here today.
Doctor, I have been experiencing some stomach pain recently.
Some stomach pain. Oh, I'm
Yes.
sorry to hear that. And when did the stomach pain start?
It started about a month ago, on and off.
What, a month ago?
But recently, yesterday, as recent as yesterday.
Yesterday, you felt the same stomach pain? I
Yes.
see. And do you know what triggered the pain and made it worse?
I believe when I came back home after my party with my friends.
So you felt the pain after a party with friends.
Yes.
And what were you doing at the party? Eating and drinking?
Yes, I have been drinking beer with my friends and I have been eating barbecue, chicken barbecue, grilled pork,
Okay.
and so on.
So you were eating some barbecue and you were drinking alcohol.
Yes.
And you felt pain after that?
Yeah, when I came back
When
home.
you came back home, okay. Can you tell me what makes the pain lessen?
Usually after I sleep, it lessens a lot.
Okay, so the next day after sleeping, it feels
Although
better?
the pain is still there, just like right
So
now.
you still feel it even though you're sitting right here?
Yes.
Okay. On a scale of 1 to 10, where 1 is no pain and 10 is the worst pain, how would you rate your pain right now?
About 2 or 3.
2 or 3, that's not too bad, okay. How about right after the party, how did you feel?
It's about 8.
Oh, an 8, that's terrible, I'm sorry to hear that. And can you describe the pain for me? How do you feel exactly?
Feels like someone is squeezing my stomach.
Someone squeezing your stomach.
Gut-wrenching pain.
Gut-wrenching pain, I see. And where exactly do you have the pain? Can you show me?
Over here, doctor.
Right there? Okay, that looks like it's above your stomach.
I believe so.
Okay, above your stomach. And you mentioned you started feeling this a month ago. Has it been constantly, this 2-3 pain has been constant for the last month?
The 2-3 pain, it disappears after a day or 2, but every time after the party, it comes back.
Okay, I see. So it does come and go.
Yes.
Okay. All right. And do you have any other symptoms?
None that I can recall.
Any other problems that you have? Are you concerned about?
Well, doctor, aside from stomach pain, I also feel like vomiting.
You feel like vomiting?
Yes.
Have you actually vomited?
Not really, but
No.
I feel like vomiting,
Oh,
especially
okay.
after I drink water.
Oh, okay. Even drinking water,
Yes.
you feel like vomiting. Okay. And when does this occur?
It happens while I'm having the stomach pain.
Okay, it's about the same time.
Yes.
Okay. Do you feel it after drinking alcohol and eating the barbecue?
Yes.
Yes. Okay, I see. All right. I would like to move on to your past history. Have you ever been diagnosed for any diseases or conditions?
I have been diagnosed with ulcer before.
An ulcer. Is it similar to the symptoms you have here?
Quite similar.
Okay. And were you treated for this ulcer?
Yes.
And how did the treatment work?
I think it went quite well because
Okay.
that was 3-4 years ago and I believe it was over.
Okay. And what did you do to treat your ulcer?
Took some tablets. I don't exactly remember the tablet name,
Okay.
but I also changed my lifestyle a little bit.
Uh-huh.
Drank less alcohol.
Okay. And can you tell me about your alcohol consumption? How much do you drink right now?
About 3 bottles 3 times a week.
3 bottles of beer?
Yes, 3 times a week.
Okay. And that's regularly?
Fairly.
Okay, do you smoke?
No.
You don't smoke. Do you sleep regularly?
Yes.
Do you have any problems sleeping?
Sometimes, but usually no.
Okay. Do you a lot of stress in your life right now?
A little bit, but it's manageable.
It's manageable, okay. And tell me about your activity. Do you exercise regularly?
Not really.
Not really, okay. All right. I would like to go back to talk about your family. Are your parents and family members alive and well?
Yes.
And do they have any conditions or illnesses?
Just my father. He has been diagnosed with chronic hypertension.
Okay. Thank you for that. All right. Based on what you've told me so far, it looks like you have might be having an ulcer again that's reoccurred. It might have been triggered with the food and alcohol that you've been drinking and eating. So I'm going to recommend that either you take an over-the-counter antacid. If that doesn't work, I can recommend H blockers, which are a little bit stronger and can help reduce the acid in your stomach. If those two options don't work, I might recommend a gastroscopy to see inside your stomach. The gastroscopy is like a camera you put through your mouth, and it can see if there's ulcers in your stomach. Have you done that before?
No, I don't.
You didn't have to do that before. Okay. So, do you have any questions about those options?
Are they expensive?
The antacids are not expensive. The gastroscopy, well, if you have insurance, should not be too reasonable, but it is a little bit uncomfortable to do the procedure, and you have to make an appointment.
I see. How about the actual medication?
The medication you can get today, and it can relieve any of the pain you have right now. But it won't fix your problem. So the best option right now is to change some lifestyle things, such as eating more healthier foods, making sure you sleep well, and then also reducing your alcohol.
Thank you very much.
All right, any other questions?
No questions.
All right, thank you very much. Have a good day. I hope your symptoms get better.
Thank you.